This video will cover the dengue virus, its epidemiology, serotypes, and transmission. We will also discuss sources of mosquitoes, vertical transmission, and prevention methods, including vaccination. Further topics include the WHO classification, disease course and phases, warning signs, investigation, and treatment plans. We will also address home care for dengue patients and provide references. Dengue viruses are spread to people through the bite of an infected Aedes species mosquito, specifically Ae aegypti or Ae albopictus. These mosquitoes also transmit Zika and chikungunya viruses. About 4 billion people globally live in areas with dengue risk. Each year, up to 400 million people are infected, leading to approximately 100 million illnesses and 40,000 deaths from severe dengue. Dengue is caused by 4 related viruses: dengue virus 1, 2, 3, and 4. Because of this, a person can potentially be infected with dengue as many as 4 times in their lifetime. Transmission occurs through the bite of Aedes species mosquitoes. These are the same types of mosquitoes that spread Zika and chikungunya viruses. Mosquitoes lay eggs near standing water in containers like buckets, bowls, and flower pots. They prefer to bite people and live near them, biting both day and night. Vertical transmission from mother to child can occur during pregnancy or around birth. There's one documented case of dengue spread through breast milk, but breastfeeding is still encouraged. The cycle of replication and transmission begins when a mosquito transmits the virus. It replicates, infects white blood cells, and circulates in the blood. A second mosquito ingests the virus, where it replicates in the midgut and salivary glands. Dengue prevention focuses on avoiding mosquito bites. A vaccine, Dengvaxia, is available in some countries for those aged 9 to 45. The WHO recommends it only for those with confirmed previous dengue infection. The incubation period is typically 5 to 6 days. Asymptomatic or mild infections are common. Classic dengue fever begins abruptly with fever, malaise, headache, retrobulbar pain, and severe backache. Cough is rare. The fever typically subsides after 3 to 4 days, may return mildly, and severe fatigue and depression can persist for weeks after the fever is gone. Dengue hemorrhagic fever, DHF, is a severe form often resulting from sequential infections with different serotypes. It features capillary leak syndrome, thrombocytopenia, hemorrhage, hypotension, and shock. This slide depicts the symptoms associated with dengue. Warning signs for progression to severe dengue in the late febrile phase include persistent vomiting, severe abdominal pain, mucosal bleeding, difficulty breathing, lethargy, postural hypotension, liver enlargement, and hemoconcentration. Diagnosis is easier in endemic areas with characteristic symptoms. Mild cases resemble other viral infections. Leukopenia and thrombocytopenia are common findings. Diagnosis is confirmed by a 4-fold rise in IgG antibody titers, dengue virus isolation from blood, or detection of dengue virus RNA by PCR. Serological tests may show cross-reactivity with other flaviviruses. NS1 tests detect the non-structural protein NS1, which is secreted into the blood during dengue infection. These tests use labeled antibodies and are typically performed on serum. A positive NS1 test confirms dengue infection without serotype information. A negative result does not rule out infection, and in such cases, testing for IgM antibodies is necessary to check for recent exposure. Dengue virus-specific IgM and neutralizing antibodies typically develop late in the first week of illness, remaining positive for about 12 weeks and sometimes longer. A positive IgM result indicates a presumptive recent dengue infection. For negative IgM results, follow-up testing is needed depending on the timing of symptom onset and other test results. There is no specific medicine or antiviral agent to treat dengue. Treatment is symptomatic. Aspirin should be avoided due to the risk of bleeding. Volume replacement and blood transfusions may be needed for patients in shock. With intensive care support, mortality rates are 1% or less. Corticosteroids and existing antivirals are not effective. Mosquito breeding places must be abolished and adult mosquitoes destroyed. Supportive care involves staying well hydrated and avoiding aspirin-containing drugs, and other NSAIDs like ibuprofen. Fever should be managed with acetaminophen and tepid sponge baths. Febrile patients should avoid mosquito bites to reduce transmission. If you suspect dengue, see a healthcare provider and mention any recent travel. Rest, Take acetaminophen for fever and pain, but avoid aspirin or ibuprofen. Drink plenty of fluids, such as water or electrolyte-added drinks. Dengue symptoms can become severe quickly. Severe dengue is a medical emergency. About 1 in 20 people with dengue develop severe dengue, which can cause shock, internal bleeding, and death. Prior dengue infection, infancy, and pregnancy increase the risk of severe dengue. Severe dengue may require close observation and monitoring in an intensive care unit. Prophylactic platelet transfusions are not beneficial, and corticosteroids should not be used. If a family member is sick with suspected dengue, watch them closely, as the condition can worsen rapidly between the 3rd and 7th day as the fever subsides. A doctor can order tests to confirm the diagnosis. For fever management, enforce bed rest and control high fever with cold sponging and acetaminophen or paracetamol every 6 hours if needed, up to 4 doses per day. Do not administer ibuprofen, aspirin, or aspirin-containing drugs. Prevent dehydration by giving plenty of fluids and monitoring for signs of dehydration, which occur when too much body fluid is lost from fever, vomiting, or insufficient fluid intake. Cover sleeping areas to protect patients from mosquitoes. The references for this video include Mohammed Inam Danish Medical Diagnosis and Management, Davidson's Principles and Practice of Medicine, and Kumar and Clark's Clinical Medicine. If you have any questions, please feel free to reach out to the video creator. Thank you for watching this video on dengue infection.